Hello everybody. Under management of dental trauma, the first step is patient examination, and that is what we will discuss in this lecture. Please subscribe to this channel and check out the videos on caries, occlusion and tooth nomenclature, the links of which have been given in the description box below. Now we'll proceed with our lecture. Management of dental trauma. Now, when a patient is received for the treatment of acute trauma, the oral region is usually heavily contaminated. So the first step in examination procedure is to wash the trauma site using saline or dilute betadine solution. Now this gives an initial impression of the extent of the injury. Now while we are doing this, we ask the patients a series of questions like, when did this trauma happen? How long ago it happened? When and where it happened? Now did you lose your consciousness? Then questions regarding the medical history, like any allergies a patient has, current medications a patient may be taking, diseases like diabetes, hypertension, epilepsy, or bleeding disorder which the patient might be having, and most importantly, the tetanus immunization status of the patient. Now, after all this information is noted down, we come to the clinical examination. In trauma cases, under clinical examination, the first thing you should examine is the soft tissue wounds. Now these wounds, they should be carefully explored to check the penetrating nature, that means how deep they are, and to check for any foreign body that might be embedded in it. While you are here, do subscribe to this channel and we proceed on. Under extraoral examination, we inspect the face, eyes, ears, nose, lips to check for any deformity of the face or facial disharmony or swelling, bleeding, etc., anything that can be obviously seen. Then we come to the palpation of the facial structures. Now this is done systematically. Now you must observe this carefully. Look at the photograph which is given on the side. We begin by palpating the frontal bone and the supraorbital ridges like this. The palpation is done on both the sides to compare the two sides, like the abnormal or the normal side, followed by lateral orbital margins and then the infraorbital ridges. After that, palpation is done of the nasal bone, again both sides. Then we proceed towards the palpation of the zygomatic arc and the zygomatic bone like this to rule out any zygomatic fractures which may be present. Then we continue on to palpate the maxillary bones, and then finally we move towards the mandible. We palpate the ramus, then the angle, and then the body of the mandible, proceeding to the symphysis. And this is done on both the sides as with everything else. Now when we are palpating, our basic aim is to check for any depression, any step deformity, tenderness or swelling in any of the areas. This will give us indication of fracture in that particular area. The next is palpation of the temporomandibular joint. For preauricular palpation, we have to stand in front of the patient and place the index finger in the preauricular region, which is in front of the tragus of the ear. The patient is asked to open his mouth and then close it. This motion is repeated 2 to 3 times. While the patient is opening and closing his mouth, you have to observe for any restricted movement of the mandible, any deviation in the path of the mandible when the mouth is closing, any jerky movement, any pain in the temporomandibular joint region when the opening and closing is done, any crepitus, clicking or grating sound that may be heard. And in this manner, we can palpate the lateral pole of the condyle. Endural palpation is done to palpate the posterior part of the head of the condyle. This is done by standing in front of the patient and inserting the little finger inside the ear. Then the patient is asked to open her mouth and then close it. This motion is repeated 2 to 3 times, and once again we observe for any restricted movement, deviation in the path of the mandible during closure, jerky movement, painful movement, crepitus, clicking or any grating sound. By conducting these palpations, we are able to assess the condition or the status of the TMJ fairly well. We now come to the examination of teeth. Examine the teeth carefully, especially the involved tooth. Check the occlusion. Any disturbed occlusion indicates a jaw fracture. Now, diagnosis of enamel cracks or infections of the injured teeth is made by directing the light beam to the surface of the tooth. Now, in case there is any crack or fracture, what happens is in the light beam, the fracture will shine out like this here. In case of crown fractures, all the possible pulp exposures that can be should be detected and their size noted. But however, the detection of pinpoint perforations can be brought about only by thorough cleansing of the fractured surface, else you might just miss it. The periodontal status of the tooth can be assessed by checking its mobility and by percussing it. Now coming first to the mobility test. Now this can be done by using the handle of a mouth mirror and your finger. You can hold the tooth and try and move it and see how much mobility that particular tooth is showing. Now this particular test is used to determine the extent of a loosened tooth and which is an indication of a severe vascular supply. And then if there is mobility of a group of teeth, it will give an indication of the fracture of the alveolar processes. Percussion test. It is done by using handle of the metal instrument or finger in case of small children. The handle of the instrument is tapped against the incisal edge of the injured tooth. In case there is any pain, that means it is tender on percussion and it would indicate that there is damage to the periodontal ligament. With our clinical examination over, we have a fairly good idea about the area of injury. This area needs to be examined radiographically. Now, 3 angulations are recommended by International Association of Dental Traumatology, which are first the occlusal view. An occlusal exposure of the traumatized anterior region gives an excellent view of most lateral luxations, apical and midroot fractures, and alveolar fractures. Now here in this occlusal exposure, you can see if we check the central incisor and there's a fracture line here, it can be easily seen, or a fracture line in the apical 1/3. Supposing this particular tooth was luxated laterally, that would also be very comfortably visualized. The next view is standard periapical exposure with 90-degree horizontal angle with the central beam through the traumatized tooth. This particular exposure, here you can see there is a fracture line passing through the midroot. Next is lateral angulation from mesial and distal aspect of the tooth. Now these views, they give information about cervical root fracture as well as other tooth displacements. In case an enhanced visualization is required, then we can go in for CBCT scans. A quick rundown of the X-rays to be taken: occlusal radiograph, periapical radiograph with straight or 90-degree horizontal angulation or lateral angulations from mesial and distal aspect. Then OPG or panoramic view, CBCT scan, X-rays of the soft tissues. Coming to sensibility tests, it refers to vitality tests like the thermal test in which we do cold test and electric pulp testing, all attempting to determine the condition of the pulp. But we've seen that at the time of injury, these tests mostly give no response, indicating a transient lack of pulp response. But these tests are useful because they act as a baseline reference to compare the progressive change in the response of the pulp as the time passes. Now, with the combined information that we have got from clinical, radiographic examination, diagnosis and treatment planning can be carried out. And finally, we go for photographic registration of the trauma, as it offers an exact documentation of the extent of injury, which can be used later for treatment planning, legal claims, or for clinical research. Let's have a quick rundown of what we've done so far. So when a trauma patient comes to us, we take the patient history, followed by his clinical examination, in which we take extraoral examination. We inspect and palpate the facial structures and the temporomandibular joints. Then we conduct intraoral examination of the soft tissues, the hard tissues, checking for enamel fracture of the teeth, dentine or a pulp exposure. We check for any abnormal mobility or tooth displacements, tenderness to percussion, vitality tests. Then we conduct the radiographic examination of the affected area. We examine the soft tissues for any foreign bodies. We take occlusal radiograph for anterior region, periapical exposure of each traumatized teeth. And after all this, we arrive at a final diagnosis and we plan the treatment. The diagnosis that we arrive at can be any of the following. It can be a crown fracture, which may be an uncomplicated crown fracture. That means enamel and dentine are involved with no pulp involvement. So that can be enamel infarction, enamel fracture, or enamel and dentine fracture. Then it can be a complicated crown fracture in which there is enamel, dentine, and pulp fracture. However, the treatment plan for the children and the adults is different. Then we can have a crown and a root fracture, which may be uncomplicated, that means no pulp involvement, or complicated with pulp involvement. And it can just be a root fracture. And then along with any of these conditions, we may have a condition such as concation, subluxation, lateral luxation, extrusion, intrusion, avulsion, or complete loss of tooth structure. Now in all our upcoming lectures, we'll be discussing in details the treatment options for each of the following conditions that I have so far talked about. I hope you like this presentation. Do subscribe to this channel, like it, and share it with your friends. Check out the videos on trauma classification, dental caries, and occlusion. The links of all of them have been given in the description box below. Thank you. Have a good day.